Okay,
Hi, good morning. My name is Mavis. How are you?
good.
Awesome. I'm gonna be performing what we call an HEENT assessment, which involves some touching, and it's gonna be from your neck up. Is that gonna be okay with you? Okay. Now I'm under the understanding that we have some language barrier. So I do speak both languages. I do have to do the assessment in English for the recording purposes, but would you have any questions in the middle of the assessment, let me know and I'll translate back and forth, okay? So I'm gonna go ahead and wash my hands, gather my supplies. Are you okay, comfortable with it? All right, thank you. I'll be right back, okay? Let me wash my hands. Hi, it's me. Okay. I'm gonna inspect your head first and start there, okay? So when I'm inspecting this patient's head, I can evaluate that her head is normal cephalic, and I can see her hair distribution is even on both sides. Very good hygiene, very good posture. So I'm gonna move forward and go ahead and palpate. So I'm gonna start touching, okay? Okay. So I'm palpating her head and all around her head. I wanna cover all areas, very good. And I don't see no bumps, no lesions. I will be looking for any abnormalities, any pain or discomfort. Okay, perfect. Now I'm moving downward and I'm gonna look at your forehead and I'm looking for any broken skin, any lesions, any discomfort at this time. So let's see. And I inspected her first and I didn't see anything. So now I'm palpating. Any pain, any discomfort at this time? No, okay. So I'm moving down to her eyebrows and first I'm inspecting and no abnormalities seen at the naked eye. So I'm just gonna palpate over here, very good, very even. No issues here, absolutely great. Any pain or discomfort when I'm touching? No? Okay, awesome. I'm gonna now look at your conjunctiva and I'm going to look over here. No problems. Perfect. And there's no redness or bleeding or open sores in your conjunctiva, no lesions there, and it looks normal, and no signs or symptoms of anemia either. I'm going to look inside your eye, and what I want you to do is I want you to look over here. Okay. Perfect. And one more time. Amazing. Very good. Perfect. And one more time. Very good. Now, I want you to look forward as well. I want you to follow with your eyes, not your head, the pen light, okay? Very good. Very well. So now your pupils are pearla, which means pupils are equal, round, and reactive to light and accommodation. Okay, I'm gonna go ahead and examine your ears before I move downward. So when I examine your ear, I'm first gonna inspect. I'm gonna inspect this ear and I don't see any abnormality at the naked eye, no sores, no lesions, no open skins. And I'm gonna look at this ear too, and I'm also inspecting and I don't see any abnormalities either, any discomfort or lesions. I'm gonna palpate now your external ears. And I don't see any deformities. I don't feel any bumps, no lesions. I'm gonna do the same thing with the other eye. Very good. I'm gonna perform, before I look at your, you know what, let me look at your ear, inside your ear first and see if I see anything inside there, okay? And I'm gonna do this moving the pinner up and back. Very good. Any pain? Okay, good. No pain, no discomfort. Okay, let me see. Awesome, nothing there. Amazing. I'm gonna do the whisper test, and can you hear this? Perfect. I'm gonna do the whisper test. I'm gonna whisper a number a little bit to the side here, and you're gonna tell me what you hear, okay?
4,
Good, again.
2,
Good, and one more time.
1,
Perfect, and let's do it one more time over here on this side.
4,
Very good, and again.
2,
Very good, and one last time to make sure.
1.
Amazing, that was perfect. So what I was checking for is to make sure you have you could hear well. I like to use layman terms with the patient so they can understand. So I was making sure that you could hear well for me. Okay, now let's move downward. And we're gonna move to your shakes. I'm just gonna inspect, making sure there's no open skin, no lesions, nothing at the naked eye. And that's good. Let me palpate just to make sure your cheekbones, everything looks intact. No issues there. Okay. Any pain or discomfort? No. Let's move to your nose. And I'm checking your septum, making sure there's not a deviated septum. And I didn't see anything when I was inspecting, but you know, we have to palpate as well. And I don't palpate any abnormalities. I'm gonna ask you to take one finger, put it in your nostril, inhale, erase switch. Any breathing discomfort when you do that? Any pain, anything? Okay, perfect. I'm gonna take a peek, okay? Awesome. When I'm taking a peek, when I'm looking at any nasal discharge, any bleeding, any lesions, any abnormalities. So let me take a peek. Not red light either. And when I light this septum up, I don't see a red light on the other side. Very good, which means that everything is normal. Very good. Now I'm gonna move downward to your mouth, okay? I'm gonna ask you to open your mouth for me. Do you have dentures?
No.
Okay, you have normal teeth, right? Oh, yes.
Yes.
Okay, good. Open your mouth for me. All right, very good. And I don't see no lesions. Let me look at your gums. Good. Put your tongue inside for me. Very good. Now let's check out your uvula now. Do the you were doing first. Good, uvula rises. That's very good. Now let me check your tongue movement. I want you to stick your tongue out. Move it to that side. Good. Other side. Very good. Up. Very nice. Stick it out for me. Stick your tongue out. There you go. Let me look at your tonsils, okay? Open one more time. Very good. No abnormalities there. Amazing. And that's very good. I don't see any abnormalities, no problems, no issues there. And what I want you to do now is we're going to perform range of motion of your neck. And I want you to move your neck back. Good. Move your neck down. Very good. Move it to this side. Very good. Move it to the other side. Perfect. Now let's do that against head resistance. Move it to that side. Very good. Move it to this side. Very good. Let's shrug your shoulders. Very well. Now, look back. And I want you to swallow, please. And I'm just inspecting your trachea. Very well. Swallow for me. Swallow. Very good. Let me inspect your thyroid gland. I'm going to stand back here because I want to palpate it. Look back. Okay. Swallow again. Very good. Traba. Okay, very well. And I was palpating her thyroid gland. That's what I was doing. And now we're gonna palpate her lymph nodes. And I'm gonna start in her preocular lymph nodes. That's over here. Okay, very well. Let me see this one. Very good, very good. Now let's do your post-ocular lymph node. This back here. Okay, very good. Now over here. Very well. Now let's do your paroid lymph nodes. And those are located over here. Let's see. Very good. Your submental is over here. Okay. Okay, your tonsillar over here. Very good. And now let's do this side for that. And the tonsillar. Very good. Okay, and now your submental. Okay, let's see. Very well, very well. And now let me see your submandibular. I was missing this. Oh, okay, very good. Another thing. Okay, perfect, amazing. And now let's see your superficial cervical. Let me move here. And now that side, please. Very well. And now your deep cervical and your posterior cervical are the other ones that I want to do. Let's see. And those are non-palpable. I don't see. This is your supravicular over here. Very good. Okay, and just pull cervical back here again. And then take a good peek at it. Okay. And when I'm doing that, do you see any, do you feel any tenderness, any pain? No? Okay, very good. I don't think I palpated your mastoid muscle over here. So I'm going to ask you to open your mouth for me. Okay, again. Okay, there's no clicking sound, so that's good. All right, perfect. I had missed that one. I'm so sorry. I'm going to ask you to stand up, please. And I'm going to ask you to do the Snelling chart. I'm gonna ask you to look that way, and I'm gonna ask you to cover one eye and tell me which line can you see. What we're testing for here is we're testing visual acuity, okay? So go ahead and tell me.
The A,
Oh, it's line A. Okay, perfect, thank you. And okay, go ahead and read the line for me.
D, A, F, B, O, T, A, S.
Okay, amazing. Do that on the other side.
D, A, F, B, O, T, A, S.
Perfect. And now do it both eyes.
D, A, F, B, O, T, A, S.
Okay. Do that again, please.
D, A, F, B, O, T, A, S.
Okay, very good, very good. I was just making sure that, everything went smoothly.
So sorry, my English a little bit.
It's okay. Just making sure your visual acuity is fine. We're done here. I've performed the testing completion. I want to make sure you're comfortable and you feel okay. Is there anything I can do for you? Do you have any questions or concerns for me?
No.
Just so you know, everything I found was within normal limits. I didn't find any abnormalities at this time. Should you need anything, call me. I've put your things on that end, and here's your call out if you need me, okay?
Okay, thanks.
Thank you. Bye-bye.